This video is going to review the proper way to insert an OPA, or oral pharyngeal airway. So this airway is a basic life support airway adjunct that's designed to assist with assisted ventilations or breathing during a resuscitation of a patient or in a patient who's completely unresponsive or has a Glasgow Coma scale of 3 to improve the openness of their airway. So this airway basically sits just in the oral section of your airway, and it basically keeps the tongue out of the mouth when you have that big floppy tongue in an unresponsive, unconscious patient. These airways come in a variety of sizes. As you can see here, you have a whole set of 8 of them, and it is not a one-size-fits-all model. So you need to size these to the patient properly. So what you're going to do for sizing is you're going to measure from the corner of the mouth to the angle of the jaw and pick the oral airway that's closest to that. So we'll start here just to show corner of the mouth to angle of the jaw, and you can see that's quite large. So we can move down. We can see again, this one's quite large. And here we have one that's just about right. So once you have this, when we're inserting this airway, we need to avoid pushing the tongue back further in the mouth. So here's our mouth here. What we're going to do is first open the mouth. We can use the crossed finger technique, which is using your thumb and your finger to move the mouth open. And then you're going to take the airway and you're going to do it upside down. So when you're holding this against the patient's face, you're actually starting in this direction. And what you're doing is you're putting it in upside down to get past the tongue. And you're sliding this across what's called the hard palate. So in the mouth here, you can see this is the hard palate here, this section. And then once it drops, that's the soft palate. Those are the landmarks you're using. So once you have the mouth open with that cross finger technique, again, you're going to take your oral airway upside down. You're going to put it in the mouth, slide it across the hard palate till it hits the soft, and then twist it. And this will just sit here right at the top of the teeth and above. If the patient starts gagging or vomiting, then you can just pull the airway straight out. If it's full of fluids, you can take it and flick it to remove those fluids and try to clear it, or get a second one if it's full. And then only reinsert it if the patient, again, is unresponsive or has a Glasgow Coma scale of 3. And where this really shines is this is really helpful when we're doing assisted ventilations or breaths in terms of a cardiac or respiratory arrest. In terms of keeping the mouth open while we're sealing a mask, especially a bag valve mask on the patient. So this is our oral pharyngeal airway, and that was the insertion technique for an adult.